The coronavirus vaccine, the shot in the arm many hope will end this pandemic. Now the distribution program plagued with issues.
Our goal will be to make sure every Ohioan has access. We know there's not enough.
Not enough vaccines in greater Cincinnati and all across the country at a time when many people in communities of color debate whether the shot can be trusted.
It's about information coming from trusted resources, trusted people. And we know at the end of the day, people make decisions by that person they trust closest to them.
Let's talk about the coronavirus vaccine on this edition of Let's Talk Cincy.
From WLWT, this is Let's Talk Cincy, presented by Western and Southern Financial Group. Put our financial strength behind you.
It is an all-out war against the coronavirus. President Joe Biden wants to vaccinate 1.5 million Americans on average per day in his first 100 days in office. Welcome to Let's Talk Cincy. I'm Curtis Fuller. The approval of a vaccine brought hope, but since the first shots went into the arms of Americans, shortages and mistrust have dogged the massive vaccination process. And the very latest numbers on how many Americans have gotten the coronavirus vaccine, the CDC saying facilities all across the country have administered more than 22.7 million doses. That's about 6% of the population. The vast majority of people have only gotten one dose so far. About 3.3 million are fully vaccinated. Here in Ohio, we are vaccinating groups 1A and 1B, which is about 3 million people here in Ohio. And teachers in Ohio are also getting vaccinated in an effort to open more schools to in-person learning. However, there are more people wanting to line up to get vaccines than the amount currently available. But Governor Mike DeWine is confident that eventually there will be enough to get into the arms of Ohioans.
Throughout this vaccination process, our goal will be to make sure every Ohioan has access. We know there's not enough. We know that everybody who's trying to get it this week is not going to get it, everyone who is 75 and over. But we're going to continue to do what we can to get more vaccine out. At the same time, we have an obligation to make sure we get underserved populations and that there is equity, that there is fairness in regard to this. And so this is an ongoing process.
Well, in the meantime, the Biden administration is adding to the nation's COVID-19 vaccine stockpile by purchasing an additional 200 million doses, 100 million from Pfizer and 100 million from Moderna. The administration says they will now have enough doses to give 300 million Americans the required 2 shots by the end of this summer. Well, during this pandemic, we've heard a lot about contact tracing. This is a strategy that's been used for many decades to get control of a health crisis and save lives. The Cincinnati Health Department has received a weekly shipment of the coronavirus vaccine since December 22nd, a vital phase in this fight against COVID-19. But until enough people in a community are protected, health experts say the key to slowing the spread of this virus and helping keep your family, your community, and yourself safe is contact tracing.
My nurses turned into contact tracers. We have been going probably 6 to 7 days a week.
Tracing lets you know if you've been exposed to COVID-19, even if your most recent test was negative.
Negative right now, and you walk into the grocery store with your mask half below your nose, or you touch your face and you didn't wash your hands, or you go and you huddle with your friends and think it's okay. And I was tested yesterday, or I was tested 2 hours ago. And then you go and you engage in some type of activity that you could have been exposed, then you could in fact be being infected at that time.
Rosa Kama is a registered nurse and has been involved with contact tracing here in Greater Cincinnati. She says even with the vaccine, safety protocols should not be taken for granted.
We cannot be unguarded. You have to pay attention to the standard rules. It's 6 feet apart, less than 15 minutes, wear your mask and wash your hands at all times.
Tracing is a detailed work, getting information from people who are around someone diagnosed with COVID-19. Expect a call from a health department contact tracer.
Please think about this. This is the only tool that we have to really isolate the virus in certain environments.
You will not be asked for money, your social security number, bank account information, salary information, or credit card numbers.
Be patient with us. If somebody gives you a call, just try to answer all the questions because there's a reason to ask those questions.
And you should also be aware that the Ohio Department of Health has issued a warning about scammers posing as contact tracers. Now remember, legitimate contact tracers will initially reach out by phone and will never ask for your private financial information or your social security number. Up next, the new COVID vaccines. What's being done to address the issues of access and trust, especially in minority communities, when Let's Talk Cincy continues. A report by the Kaiser Foundation showing 35% of African Americans are hesitant to get the COVID vaccine, the majority saying they have concerns about possible side effects. Now, this skepticism about the vaccine is another challenge in this battle against COVID-19.
Education is the only way to address mistrust.
Renee Mahaffey Harris leads the Center for Closing the Health Gap. The organization understood early the challenges faced by this crisis and the impact on underserved communities.
Some months ago, Dr. James Powell, who is the principal investigator for the National Medical Association's Project Impact, which is an effort that they have had underway for some time now, to address the education of why we must participate in clinical trials. And so then COVID happened. And so Dr. Powell's work started accelerating because we now know that because of the disproportionate impact of COVID-19, we must be in the trial. Obviously, the first trusted vehicle for us relative to our healthcare are our physicians, our primary care physicians. So the Cincinnati Medical Association has joined with the National Medical Association, with Dr. Powell, along with the Health Gap, along with Commissioner Moore, in bringing together conversations of education, which first started with educating the physicians on the clinical trial process, because just because they went to medical school doesn't mean that their focus has been on the research and how you get to a vaccine. The physicians saying, we do want to be advocates for our patients. However, we need to understand this process better. So they stepped back and have done those educational sessions.
And there is much work ahead for community-based organizations.
So while the vaccine trials had the percent of people that they would like to ensure that, there's the right makeup, now the question will be, who will take the vaccine?
If you're watching me and you're African American, think about how we lead in hypertension, how we lead in diabetes, how we're leading diabetes and complications. On top of that, if you are infected with this virus, and we are already leading so many other diseases and conditions, and some of it is just genetically based, then we have to cover ourselves with this vaccine because we already have so many other different issues that we're actually fighting currently. So that's where I would take on that. I know it's a lot of information out there, and it sometimes could be too much, especially when we're thinking about some past history and things. However, we are currently facing a lot when it comes to comorbidities and chronic conditions.
We continue to have these dialogues and bring together the knowledge and research and expertise with each of us. And I think we can get to a point of having better information that we can inform our decision around a vaccine, which is frankly our only way out of COVID-19.
Now, researchers say it's important for Black Americans to take part in the development of coronavirus vaccines. WLWT News 5's morning anchor, Colin Mayfield, has been part of the trial conducted right here in Cincinnati. He gives us a look now inside the vaccine trial and the progress in the journey.
Blood samples, a swab, and a brief health exam, then we get down to business.
And we're going to take a listen.
Like many scientific studies, participants like me don't know if they got the real drug or a placebo. For me, it happened to be the placebo, so it's now time for my first shot of what's proven to be a very effective vaccine.
This is cool. I think the vaccines are very effective, 95% effective. They prevent disease, and we're certainly working on understanding if they prevent transmission of infection. But we're pretty hopeful that that's going to be as possible as well.
28 days from now, I'll receive a second dose, but my work isn't done. Like the other 30,000 volunteers, I'll continue as part of the trial for the next year and a half. Doctors, including Carl Fichtenbaum from UC Health, will work closely with me to learn how long these vaccines might protect us if they're effective against mutations.
But we don't know if people are going to need boosters. We do have new variants that are circulating, and we probably will need to give some boosters to ensure that we can control those variants as well, because the virus is trying to evade our immune system.
All of this aimed at safety, research, and of course trying to get more vaccines on the street for you.
We don't have enough vaccine. We don't have enough vaccine sites. I think people have to hang in there.
Up next, a conversation with Colin. He tells us why he participated in this trial when Let's Talk Cincy returns. Well, there has been a lot of discussion about the vaccines available to deal with COVID-19, and I want to bring in someone who has been part of a study. Very interesting. Now, normally you see him on the morning news every day here on Channel 5, but in this case, I'm going to talk to him not as the journalist that he is each day, but the role you played in a study, and everyone knows Colin Mayfield. So tell me about this.
Yeah.
You were part of a study.
Right. For Moderna.
For Moderna.
Yeah. So it came, I try to usually never say no. That's kind of something my dad has taught me. And so a friend of mine who works for Dr. Fichtenbaum, who's the lead investigator at UC, and works in infectious diseases, the lead doctor there, asked me about it and said that he needed black men. Would I want to be a part of it? Is it something that I wanted to report on? Absolutely. You know, a lot of people ask me, you know, were you scared? Were you worried? Those type of things didn't really go through my mind. But at first, I just wanted to see if I could help. I hadn't seen my parents. You know, at that time, it'd been 9 months. And so I felt like, you know, if this opportunity was for me to do something about it, and maybe there could be some progress at the other end once we, you know, get through this pandemic and got the vaccine up and running.
So if I remember correctly, this took place during the summer?
Yes, it was right on the cusp, right about August. They had asked me about that. So I guess you come in, once you say yes, the first visit is a little bit longer. It's about 2.5 hours. They do a couple swabs in your nose, make sure you don't have COVID starting out. Take some blood samples, which isn't always fun for a lot of people. Didn't really have a problem with that. And then they go through, Dr. Fichtenbaum did with me about what I would experience, how many times I'd be at the hospital, what would happen if I did get sick. And it was really a comfort to me to know that I had that top level care within a call. Dr. Fichtenbaum, you know, put his number in my phone, and I didn't have any qualms with that after that.
No side effects? You've been fine?
Well, so far, I've been great. I had 2 injections, one in around September. The second one proceeded about 3 to 4 weeks after that in October. But I had no real side effects other than I lost taste my first shot. I called the doctor quickly as I could. They said, that's not normal, so we want to bring you back in. So I guess I was the only one that tabulated that response. They hadn't seen that in any other individuals, but I didn't have any redness or any swelling or any sensitivity to the touch like you would in a normal flu vaccine. But that's what they were equating this to be like. So that's another reason why I felt fairly safe in trying it out.
We should point out 600 people locally were included in this study.
Yes.
30,000, I think you were telling me, nationwide.
Nationally. Yeah,
wow.
From 80 to 100 different sites across America. So, but yeah, there were a lot of individuals that took this step before me, because there was data prior to August that people had already started these trials. So I'm not the real hero here. Some of those folks had no idea what they were getting themselves into, what the reaction could have been. I only knew that information because there had been people that preceded me. So I also felt thankful for that and blessed, you know, to know that information.
And of course, you're aware that there is a hesitancy now by some to get the vaccine. Now, look, some people might just be afraid to do it.
Right.
But then there are some, if we keep it in a historical context, especially for the African American community, there is a reality history
Yeah.
that makes a lot of people fearful of what they might be receiving in any way. And so I would imagine that was in your mind as you went through all of it.
Absolutely. Well, Dr. Fichtenbaum talked about that. As you know, historically, the African American community, I don't want to single out, but many minorities have been left out of this vaccination type process. Yeah. So we don't really understand, in what Dr. Fichtenbaum was explaining to me, how certain vaccines work with different DNA. We all have different DNA, but in some cultures and in some origins in DNA, there are certain sicknesses that deal with heredity in certain bloodlines. So to understand the total effect on a person and their longevity, we need to have everybody with their ethnic understanding of where they are on the chart. And so for me, again, yes, that was huge. I even spoke to my dad about it because there was times when he had been offered a vaccination process like this in the Air Force and may have been excluded, maybe he wasn't, but was a little bit leery about it as a whole, and that's something that I think is in the African American culture, but it's understandable why.
As you look at people now questioning whether they should get the vaccine, again, it's an individual choice, but just based on what you've learned and what you've read and studied yourself.
There's numbers at St. E where around 20% of people still don't necessarily want the vaccine, whether they be staff, doctors and nurses. That's understandable. I think, unfortunately, it doesn't really matter how we feel about getting it. At some point, it may be mandated, depending on what we want to do. Flying, we know that British Airways over in the UK, they're making their employees and people that fly with them download a certain technology that lets them know that they can scan a QR code whether they've had the vaccine or not. So I think if people are going to want to get back to the life that they used to see back before March, I know it's been a long time. Unfortunately, I think that's going to be a requirement, and I'm not sure if that's going to fall to the employers, to the states, who knows? Unfortunately, that probably will make people upset. But to travel and to be around folks, herd immunity isn't expected until at least August. So we've got some time, and I think that doesn't necessarily stamp on the feet of people that have done this and been in the trial. But think about that. There have been people that have put their lives on the line, and 300,000 plus Americans that have died from this. And it may even go up. And so I think about all those people that have lost somebody. Why not? Let's stop it in its tracks.
My final question, you talk about your mom and dad all the time. When you finally told them what you've done, I would imagine they would have been pretty proud of you. Huh?
They were apprehensive about it, like any parents would be, But my father served in the military, and this isn't like that. I don't put it up in that category at all. But this is like serving your community, and I try to do that in any way that I can, and this was an opportunity for that. I don't want to toot anybody's horn, but this is a way for people to try and get involved, and we always look for opportunities like this, and sometimes you got to put your money where your mouth is.
Yeah. Well, we're proud of you too, and thanks for doing this. I know you're not normally
talking about yourself is not something I do often, so thanks, Curtis.
Well, thank you. We'll be back in a moment. And finally today, COVID-19 has opened our eyes to many health disparities, but let me introduce you to a third-generation healthcare worker responding to the growing need by starting a business in the midst of this pandemic.
I am one of, I want to say, 18 urgent cares that will be supplying the vaccine. And the way the vaccine will be delivered is they're delivering it to the higher populated places, like the hospitals are getting it first. And the nursing homes are second. Then they'll come to centers like ours. The thing with the vaccine is that the way it's being delivered in the community is it's being delivered, its goal is to be for the greater good. The greater good being the more high-risk population. It starts with them, which is our elderly people who are 75 and up. They'll have first dibs at it. They'll have access to it before anyone else. Then the age will drop. And that's how they'll go about it. Currently, there is no vaccine on the market for anyone under the age of 16. It has yet to be tested on anyone under the age of 16. We as humans always fear the unknown. And one thing I have realized is that the more people understand, the more confident they are in their decision. I personally don't judge those who take it. I don't judge those who don't take it. However, I will say that it depends on your risk factor. And when I say your risk factor, if you're a person that has asthma, COPD, emphysema, anything that is pulmonary related, I would suggest that you receive the vaccine. I would suggest that you take it serious about receiving the vaccine. If you're a person who gets the flu vaccine yearly, you're a candidate for the COVID vaccine. If you have questions, seek out answers. There's always someone who's available to speak with you about it. There are advocates out here. There are physicians. There are other healthcare professionals that are all about it. And one thing I know is that when you don't understand something or how it works, of course, you don't want to be bothered with it. And that's a natural response. So I will say seek out an understanding as to exactly what the vaccine does, exactly what your pros are, exactly what your cons are, and what you think would be the best decision for you. My heart has always been for the community. Those who do know that I am the descendant of medical professionals, both grandmother and mother. And one thing I've realized is that being in the medical profession, you have to be a servant at heart at all times. You have to love people, you have to enjoy people, and you have to enjoy caretaking. You have to enjoy educating. You have to enjoy being an advocate. You have to enjoy being able to be patient with people and being able to cater to their needs, to cater to their desire to want to understanding, their desire to want to be healthy. Sometimes that too is tested in the form of me wanting more for people than they want for themselves. But I can only be me. I can only help. I can only do what I can. So business has been great, not only because of the COVID, but it has been great because of people realizing that there is someone out here that cares. I care about your health more than I care about your financial means to get help for yourself. I am a patient advocate through and through. I have programs where if you are underinsured or uninsured come up. I'd rather you be taken care of than to worry about how to take care of being taken care of.
You know, that's a powerful message because information is power. And so as she said, seek out help if you have questions, and just call the health department and other places like that where they have the information to help you. Well, that does it for the program today. Thanks for joining us, and we hope that you will tune in again next week for another edition of Let's Talk Cincy.